So welcome to another section of the program. We are looking at first impressions in service delivery. First impressions are important to service delivery. Good first impressions build trust and confidence in patients, in your visitors, staff, and your colleagues. Within the first few moments of meeting you, these people will form an opinion of you. Right or wrong, that opinion may greatly influence your ability to do your job. First impressions, very important. Now let's look at the elements of your first impressions. The first one is visual. Visual has to do with your appearance. So upon first contact with a service provider, a healthcare service provider, make good eye contact and then be in control of your facial expressions. Do you know that your facial expressions can do two things to your patients, your customers, your visitors? If you have an unwelcoming and unfriendly facial expression, what will happen is that you will secrete cortisol into the bloodstream of your customer or your patient or your visitors. And cortisol is a bad feeling hormone. So that customer or patient will be unwilling to relate or interact with you. On the other hand, if you have a welcoming, cheerful facial expression, upon meeting you, the customer will have what we call oxytocin in the bloodstream, which is a good feeling hormone. And then we feel very free and open to want to interact or relate with you. So managing your facial expressions when meeting with your patients or customers or visitors are very important. Don't roll your eyeballs or sigh when meeting with a patient. Nod your head, but don't overnod it anyway. Nod it slightly when listening to show your patient that you are engaged with what he or she is saying. That shows acknowledgement. And then wear your proper uniform, okay, and a visible name tag. Your proper uniform and a visible name tag. And then follow personal cell phone or iPod policies. It is very unprofessional to be on your phone when you are having a conversation or an interaction with your patient or a customer or a visitor in your healthcare facility. Another way to create the first right impression is send the right message. How do you send the right message? This is how you do that. You have what we call the dimensions of sending the right message. So the dimensions are the verbal, vocal, and visual. And then what about the cue of communication? What we call the communication cue. Has to do with your choice of words, your tone of voice, and then the look of your communication. Okay, and you can have this in two ways, face to face or over the phone. Now let's take the first dimension, verbal, and then what is the cue? The cue for verbal is your choice of words. So in a face-to-face setting, 7% of what people believe is based on the words they hear. And then over the telephone, 13% of what people believe is based on the words they hear. Okay, let's look at the second dimension, vocal. The cue, there is tone of voice. In a face-to-face setting, 38% of what people believe is based on how the words are spoken. And over the phone, 86% of what people believe is based on how the words are spoken. And let's look at the third dimension to sending the right message. That has to do with the look of your communication. That is the cue. In a face-to-face setting, 55% of what people believe is based on what people see in another person. And over the telephone, 1% of what people believe is based on what people see in another person. So sending the right message is an integral part of creating the first right impression. I'm going to be introducing to you a framework I call the AIDET framework. And that will help to build trust, okay, with your patients, with your family members, with one another, to help reduce anxiety and improve perception of care and service. I have a small formula I want to share with you here. The formula says decreased anxiety plus increased compliance equals to improved satisfaction. Decreased anxiety plus increased compliance equals to improved satisfaction. So let us see, why do we use this framework, the AIDET, with your patients? First, it helps to reduce patient and family anxiety by establishing trusts. Second, it improves compliance for better outcomes because patients will cooperate more readily with their plan of care as a result of that trust. And third, clear communication creates a safe environment to receive care. So AIDET helps you build customer loyalty, okay, and we want to be their preferred healthcare provider of choice. Why should you use AIDET for or with your coworkers? For your coworkers, it reduces coworker anxiety about whether or not they can count on you by establishing trust. Also, it improves teamwork because colleagues will cooperate more readily with you as a result of that trust. 3, it creates clear line of communication, which makes it more efficient, helpful, and healthier work environment to be in. So the AIDET helps you build loyalty to one another. We want to feel good about the people we work with and work for. Very important. So what are the 5 fundamentals of the AIDET? First is to focus on the A and the I, to show courtesy and respect to people. So the A is acknowledge, the I is introduce, and then you go to the second, which talks about the other 3 fundamentals. You focus on the D and the E to keep people informed. So the D is duration, and then the E is explanation, and finally the T there is thank you. Always thank your patients or your clients or your customers after every encounter you have with them. So what are the tips, and when and how can we use the AIDET? So the elements of the AIDET are important to every interaction with a customer on some level. The elements of the AIDET do not have to be delivered in any specific order anyway. So there are times when you will need to verbalize only 1 or 2 of the elements of the AIDET. So you want to ask yourself the questions. Are there gaps I may need to fill for a person I'm talking with? Okay, so when talking with a customer, a patient, walking down the hall, we have what we call the 10/5 rule, which is a visual manifestation of your organization's commitment to excellent service by everyone in that organization. So, at 10 feet, make eye contact, smile, and or nod to those you encounter. At 10 feet down the hall, the waiting room or the reception. At 10 feet down the hall, smile, make an eye contact or nod to those you encounter. And at 5 feet, deliver a verbal hello. Is this an opportunity? Does something look wrong? Do they look lost? Can I see a gap? If no, move on. If yes, approach the customer, introduce yourself, and ask how can I help you? Okay, so let's take a few samples. For an external customer, hello, I am Barry, one of the employees at ABC Healthcare Facility. You seem to look a little bit lost. Can I help find you something? For your internal customers, hello, I am Barry from the admin department. You look a little bit upset. Can I help you do something or assist you do something? So these are a few ways you can apply the AIDET to guaranteeing exceptional, outstanding customer service. Again, your vocal tone of voice is very important. Smile. It can be seen and heard in your voice. The pitch, the very pitch of your voice. Okay, it can also be seen and heard. The volume. Speak loud and clearly to indicate confidence and commitment. And then emphasis. Emphasize certain words during your conversation to convey meaning and importance. And then enthusiasm. Sound interested by asking questions. So, when greeting, always greet with a smile and with the greeting of the day.